Now for the 15 muscles that cross the elbow joint from deep to superficial. Supinator has an origin at the lateral epicondyle of the humerus, supinator crest, and the supinator fossa of the ulna. It inserts on the anterior, lateral, and posterior aspects of the proximal 1/3 of the radius. This insertion site is located superior to the insertion site of the pronator teres muscle. It contributes to the floor of the cubital fossa. It is responsible for supination of the forearm at the proximal radial ulnar joint. It is innervated by the posterior antebrachial interosseous nerve. Blood supply includes the posterior interosseous artery and the radial recurrent artery and the recurrent interosseous artery. Triceps brachii. The long, flat triceps brachii tendon attaches the muscle bellies of the medial, lateral, and long head of the triceps brachii muscle to the superior end of the olecranon of the ulna and the antebrachial fascia. The origin of the long head of the triceps is at the infraglenoid tubercle of the scapula. The medial and lateral heads of the triceps originate on the shaft of the humerus. The medial head originates inferior to the radial groove, while the lateral head originates superior to the radial groove. Triceps is innervated by the muscular branch of the radial nerve. The blood supply to the triceps is provided by the deep brachial artery and the posterior circumflex humeral artery. The triceps extends the elbow. The lateral head is generally only activated against resistance. Extensor carpi radialis brevis. Origin is at the lateral epicondyle of the humerus via the common extensor tendon and inserts at the dorsal aspect of the base of the third metacarpal bone. Common extensor tendon is a combined tendon for 4 to 6 superficial muscles in the posterior compartment of the forearm. Extensor carpi radialis brevis, extensor digitorum, extensor digiti minimi, and extensor carpi ulnaris. The ECRB, extensor carpi radialis brevis, is innervated by the deep branch of the radial nerve. The ECRB blood supply is the radial artery and the radial recurrent artery. The ECRB muscle extends the hand at the radiocarpal joint, which occurs when the extensor carpi radialis longus and extensor carpi ulnaris muscles contract simultaneously with the ECRB. It also abducts the hand at the radiocarpal and midcarpal joints, which occurs when the extensor carpi radialis longus and flexor carpi radialis contract with it. Flexor carpi ulnaris. Two origins. One is at the medial epicondyle of the humerus via the common flexor tendon. The other point of origin is on the posterior medial aspects of both the olecranon and the proximal 2/3 of the body of the ulna. The FCU inserts on the pisiform, hook of the hamate, and the palmar aspect of the base of the fifth metacarpal bone. The FCU is innervated by the muscular branch of the ulnar nerve. The ulnar nerve passes behind the medial epicondyle of the humerus, where it can be palpated with the finger. It enters the forearm by passing between the two heads of the FCU and lies on the medial aspect of the flexor digitorum profundus. The arterial supply of the FCU is the posterior branch of the ulnar recurrent artery, as well as the ulnar artery. The FCU is responsible for wrist flexion and wrist adduction, movement towards the ulna. Extensor carpi ulnaris. The point of origin is at the lateral epicondyle of the humerus via the common extensor tendon and the posterior border of the ulna. It inserts on the medial aspect of the base of the fifth metacarpal bone. The ECU is innervated by the posterior antebrachial interosseous nerve, C7 to C8. Radial nerve branches into the deep branch of the radial nerve, which then branches into the posterior interosseous nerve of the forearm, which itself gives off a muscular branch to the ECU. The blood supply is from the posterior interosseous artery. The brachial artery divides into the radial and ulnar arteries. The ulnar artery sends off the common interosseous artery, which then gives rise to the posterior interosseous artery. The ECU is responsible for extending the hand at the radiocarpal joint, which happens when the extensor carpi, radialis longus, and brevis contract simultaneously with the ECU. The ECU also adducts the hand at the radiocarpal joint, which happens when the FCU and the ECU contract simultaneously. Extensor digiti minimi. The origin is at the lateral epicondyle of the humerus via the common extensor tendon. Insertion is at the extensor expansion of the small finger. The EDM is innervated by the posterior interosseous nerve of the forearm, which comes from the deep branch of the radial nerve. The EDM's blood supply comes from the posterior interosseous artery, which originates from the common interosseous, which itself comes off of the ulnar artery. The EDM extends the DIPJ. It extends the middle phalanx of the small finger at the PIPJ and extends the proximal phalanx at the MCP joint. It assists with the extension of the hand at the radiocarpal joint. It can contract with the tendons of the extensor digitorum during extension of all four fingers, or it can contract alone, leaving the other digits flexed. Extensor digitorum. Its origin is at the lateral epicondyle of the humerus via the common extensor tendon. Insertion. The fibers of the extensor digitorum muscle travel inferiorly to the hand and insert onto the dorsal aspect of the bases of the middle phalanges of the index, middle, ring, and little fingers. The dorsal aspects of the bases of the distal phalanges of the index, middle, ring, and little fingers. The section you see is just distal to the quadrate ligament. At the elbow, the extensor digitorum is dorsal or superficial to the supinator muscle and the EDM. It is lateral to the extensor carpi ulnaris and medial to the extensor carpi radialis brevis, which itself lies medial to the extensor carpi radialis longus. It is innervated by the posterior antebrachial interosseous nerve. Blood supply is from the radial recurrent, anterior and posterior interosseous arteries. Extensor digitorum is involved in multiple actions. It extends the distal phalanges at the distal interphalangeal joints of the index, middle, ring, and little fingers. It extends the middle phalanges at the proximal interphalangeal joints of the same fingers. And it extends the proximal phalanges at the metacarpal phalangeal joints of the same fingers. It also assists in extension of the hand at the radiocarpal joint. Arteries. This muscle consists of two heads, a large humeral head, which originates via the common flexor tendon from the medial supracondylar ridge of the humerus, and the adjacent antebrachial fascia, a small ulnar head, which lies deep to the humeral head, and originates from the medial aspect of the coronoid process of the ulna. The common flexor tendon is the combined tendon for all five superficial muscles in the anterior compartment of the forearm, which are pronator teres, flexor carpi radialis, palmaris longus, flexor carpi ulnaris, flexor digitorum superficialis. The fibers of the pronator teres travel inferolaterally to the middle of the forearm and insert via the flat tendon onto the middle 1/3 of the anterolateral aspect of the radius. At the elbow, just distal to the joint capsule but proximal to the biceps insertion, you observe the following relationships. Pronator teres is lateral to the flexor carpi radialis, which itself is lateral to palmaris longus and flexor carpi ulnaris. It is superficial to the flexor digitorum superficialis. The brachial artery runs along the lateral edge of the pronator teres. The median nerve and the anterior branch of the ulnar recurrent artery pass between the two heads of the pronator teres. Actions: it pronates the forearm at the radial ulnar joints and assists in the flexion of the forearm at the elbow joint. Brachialis. It originates from the distal half of the anterior aspect of the humerus and 8 adjacent parts of the intermuscular septum. The proximal end of its origin site on the humerus is V-shaped and surrounds the distal end of the insertion site of the deltoid muscle. The fibers of the brachialis travel inferiorly and insert onto the anterior aspect of the coronoid process of the ulna and the tuberosity of the ulna. Anatomic relationships. The brachialis muscle is found in the anterior compartment of the arm. It is a flat fusiform type of skeletal muscle. It is located anterior, superficial, to the humerus, posterior, deep to the biceps brachii muscle, and the musculocutaneous nerve. It's medial to the brachioradialis muscle, radial nerve, and the radiocollateral and radial recurrent arteries. The brachialis contributes to the floor of the cubital fossa. Brachialis actions include flexing the forearm of the elbow joint. This action is not affected by pronation or supination of the forearm. Biceps brachii. It has two heads. The short head has an origin at the coracoid process and a location that is anterosuperior to the origin site of the coracobrachialis muscle. The long head has its origin at the supraglenoid tubercle. They insert at the radial tuberosity. The tendon gives off a flat tendinous expansion known as a bicipital aponeurosis, which travels inferomedially to attach to the antebrachial fascia. The biceps brachii is innervated by the musculocutaneous nerve, C5 to C6. The arterial supply is from the brachial and anterior circumflex arteries. Anatomic relations. The biceps brachii muscle is found in the anterior compartment of the arm. It is anterior or superficial to the brachialis muscle, medial to the musculocutaneous nerve as it becomes the lateral antebrachiocutaneous nerve. The musculocutaneous nerve is just medial to the cephalic vein. They are separated by the brachial fascia, with the cephalic vein lying superficial to the brachial fascia and the musculocutaneous nerve lying deep to the brachial fascia. Medial to the biceps is the brachial artery, which itself is medial to the anterior branch of the ulnar recurrent artery. The median nerve lies adjacent to the anterior branch of the ulnar recurrent artery. Outside of the fascia lie the anterior and posterior branches of the medial antebrachiocutaneous nerve. Actions. The biceps supinates the forearm at the radial ulnar joints. It flexes the forearm at the elbow joint, most strongly when the forearm is in the supinated position. It assists with flexion of the arm at the glenohumeral or shoulder joint. Brachioradialis. It has an origin at the superior two-thirds of the lateral supracondylar ridge of the humerus, which is located superior to the origin site of the extensor carpi radialis longus muscle. This origin is also adjacent to the intermuscular septum of the arm. The brachioradialis tendon inserts on the lateral aspect of the distal part of the radius, which is located superior to the styloid process. This section is a cut just distal to the quadrate ligament. At this location, the following anatomic relations are present. The brachioradialis is anterior or superficial to the extensor carpi radialis longus and the supinator. The superficial branch of the radial nerve and the radial recurrent artery lie between the brachioradialis and the supinator muscle. The brachioradialis is lateral to the brachial artery and deep to the antebrachiocutaneous nerve. The two are separated by the antebrachial fascia, which is indicated by the faint green color. Ankynia's origin is at the posterior aspect of the lateral epicondyle of the humerus. Its insertion is at the olecranon at the proximal end of the body of the ulna. The ankynius is found in the posterior compartment of the arm. It is a short, triangular skeletal muscle whose fibers can be found merged with those of the triceps brachii muscle. It is located posterior or superficial to the elbow joint and the annular ligament of the radius, medial to the extensor carpi ulnaris muscle, and lateral to the flexor carpi ulnaris muscle. Actions. The ankynius muscle assists in the extension of the forearm at the elbow joint. It is innervated by the radial nerve C7 to C8. Its arterial supply is the recurrent interosseous artery. Palmaris longus. The origin is at the medial epicondyle of the humerus via the common flexor tendon. To review, the common flexor tendon is the combined tendon for all 5 superficial muscles of the anterior compartment of the forearm. This includes pronator teres, flexor carpi radialis, palmaris longus, flexor carpi ulnaris, and flexor digitorum superficialis. The palmaris longus inserts onto the palmar aponeurosis and the flexor retinaculum of the hand. Relative anatomy. This section is taken just distal to the quadrate ligament. At this location, the following relationships can be observed. The palmaris longus is superficial or anterior to the flexor digitorum superficialis. It is medial to the flexor carpi radialis and lateral to the flexor carpi ulnaris.